Today we have a very special guest, Dr. Kendall, who I've been lucky enough to be friends with for 5 years. Kendall and I did residency together. She spent an extra year after residency to do a special fellowship in OBGYN, where she delivered hundreds of babies and did a bunch of C-sections. Thank you so much for being here, Kendall. It's our privilege.
Yeah, thank you for having me. I'm really excited to be here today.
It's going to be great. So let's get right to it. So when we think about birth control, right, we usually think about the hormones that you take that affects whether someone can get pregnant or not. But a lot of women are hesitant to take hormones for various reasons. And so can you talk about some of the non-hormonal options? Like, are there forms of birth control that actually don't use hormones?
Yeah, that's a really great question. And I frequently get this question with my patients as well. They want to hear about options for birth control that aren't just the regular birth control hormone pill. Some of the options that are non-hormonal include the copper IUD or Paragard, which is a little T-shaped device that goes in the uterus and basically creates a really inhospitable environment for fertilization and implantation of an embryo. There are spermicides that you can use kind of on-demand type basis prior to unprotected intercourse. There's barrier contraception, most commonly condoms. There's a new type of, similar to spermicide, something called Phexxi that lowers the vaginal pH, which doesn't kill sperm, but it slows down their motility to help prevent fertilization. And a lot of women use fertility awareness or fertility tracking, where they monitor their basal body temperatures and their cycles and are able to tell when they're ovulating based on that to help prevent pregnancy.
Great. So there actually are a few options out there for people who don't want to take hormones.
Yeah, exactly.
But we do know that the most common forms of birth control are the hormonal options. The most common form of birth control is the pill, but a lot of women are hesitant or have concerns about some side effects. I get a lot of questions about whether birth control can make someone infertile, like not able to have a baby in the future, or if it causes you to gain weight or cause acne or all kinds of stuff. And so what's the truth?
Yeah, so I can speak to some of those things. As far as whether or not birth control can make you infertile, the way birth control pills work is they prevent ovulation and help regulate your cycle, the combined birth control pills. And while you're taking them, that prevents pregnancy. But if you were to stop taking them, those effects of those pills are removed. So you would resume your cycle as you had previously prior to going on the pill. So if you didn't have fertility issues prior to taking birth control pill, it shouldn't alter your fertility going forward.
I think that's really important for a lot of people to know. So birth control pills don't actually sterilize somebody. They just stop the signal of ovulation from happening so that pregnancy can never even happen in the first place. Is that right?
Correct. If you take them the way that they're prescribed, the same time every day, again, blocks that ovulation and prevents you from potentially having an unplanned pregnancy. As far as some of the other side effects that you mentioned go, do they cause acne, weight gain, mood changes? A lot of that is based on the types of doses that are in the two hormones that are in the pill. So certainly if you're suffering from any of those symptoms after starting a birth control pill, please talk with your healthcare provider about maybe altering the dose to help minimize those side effects. A lot of times we do use birth control pills to treat acne, to help regulate mood swings around the menstrual cycle.
And just to be clear, using birth control for acne is only effective in women. Is that right?
And then another common question is, does birth control make you gain weight? And there is one type of birth control, the Depo-Provera shot that you get every 3 months that does classically cause weight gain. But most of the other ones, if they do cause weight gain, it's pretty minimal, and the doses of your hormone levels in the pill could be adjusted to help minimize that.
So we talked about a few different methods of birth control, but which method is actually the most effective?
Yeah, so we haven't talked about all the most effective methods just yet. The most effective birth control methods fall under a category of something called long-acting reversible contraception. They include the IUDs, which we mentioned the copper IUD briefly. There are hormone-containing IUDs that have progesterone. Some common brand names include Mirena, Lilata, and Kylena. There's the Nexplanon implant, which is a small progesterone-containing rod that goes just on the inside of the arm. and works similarly to the IUDs. So all the long-acting reversible contraceptives are the most effective forms of birth control. They're over 99% effective. The birth control pill itself with typical use is going to be about 90% effective, meaning if it was perfect use, taking it the exact same time every day, it would be close to 99% effective, just like the long-acting reversible contraceptive options. But most women may forget a dose here or there and aren't going to have that perfect ideal use of the birth control pills because life happens and it's hard to remember to take a pill at the same time every day.
So there's the perfect use, which is like 99%. And then there's the realistic use, which is more like 90% effective.
Correct, yeah.
Which is interesting because that's about the same efficacy as the fertility awareness technique that uses your body temperature and stuff like that, right?
Correct. That one with tracking your cycles and your basal body temperature is also about 90% effective, which matches up with the typical use of the birth control pill.
So we talked about which forms of birth control are the most effective, which are these LARCs, these long-acting reversible contraceptives, and the depot shot, like you said. But like we already know, the most common form of birth control are the pills. So with the most common form of birth control, are there certain people that shouldn't take birth control pills at all?
Yeah, that's also a very good question. So the birth control pills that are commonly prescribed contain both estrogen and progesterone. There is a type of pill that's progesterone only. It's also called the mini pill, or Micronor is a common brand name. The contraindications that we're about to mention don't fall under that type of pill, but for the combined oral contraceptives that contain estrogen and progesterone, there are certain populations that may be at increased risk for things such as blood clot or stroke that shouldn't take these types of pills because estrogen increases that risk. So this includes patients that get migraine headaches with the light auras, if you're a current tobacco user and over the age of 35, if you have a history of a stroke or a blood clot, those would be additional examples of patients that shouldn't take the combined oral contraceptive pills.
So because the estrogen in the combined pill can raise your risk of blood clots, if you already have an existing risk factor for blood clots, then you don't want to take this to push you over the edge.
Correct. Previously, when birth control pills were first approved by the FDA, they had really high doses of estrogen. So you may have heard some potential horror stories of people getting blood clots or having strokes when they take birth control pills. And that certainly was a risk factor previously, several years ago when birth control was first approved. But since then, the doses of estrogen have been lowered to safer levels. So if you're not a patient that has a pre-existing condition, then it should be a safe birth control option for you. I certainly recommend discussing with your healthcare provider, based on your personal medical history, what may be the best birth control option for you.
Yeah, actually, I had patients who were on a combined birth control pill and then had a blood clot, and so they had to switch to a different kind of pill.
Right.
Can you talk more about that?
So if you were to develop a blood clot on the combined oral contraceptive pills, then it would become a reason not to take it any longer because estrogen can increase that risk. So you could be switched to any of the progesterone only options or the non-hormonal options that we already discussed. So the progesterone only options again include the IUD implants, the Nexplanon implant, and then the progesterone only pill.
So something to think about. So we've talked about sort of the different options for birth control. We've talked about some of the risk factors. We talked about which ones are more effective or what's a better scenario for specific ones. But let's change gears for a second and talk about emergency contraception. So, with the overturning of Roe versus Wade, I've been getting a lot of questions, as I'm sure you have, about emergency contraception options and what's the best for patients. So what actually is the most effective type of emergency contraception and what options do we have out there?
Yeah, so the most effective form of emergency contraception is the copper IUD or Paragard, which is a non-hormonal birth control option, and it has to be placed within 5 days of unprotected intercourse to act as emergency contraception.
So the same IUD that can prevent pregnancy can also be placed as emergency contraception.
Yep, that's correct.
Very interesting.
Yeah. Some other options include the Plan B pill, which you may have heard about, that's available over the counter that you can get from the pharmacy. There's another type of pill called Ella that you can get as a prescription from your healthcare provider. And then there's the USP method, which...
Wait, the what method?
The USP method.
How do you spell that?
YUZPE.
That's not my favorite word in the world.
But the use method is basically a method that uses your already existing birth control pill taken at higher doses under the direction of your healthcare provider to help prevent pregnancy and act as a form of emergency contraception. Because it's a higher dose of your already existing birth control pill, it does have a higher side effect risk, particularly of causing nausea and vomiting.
So there are some options out there for emergency contraception, which involve the same hormones that we use in birth control pills. But what happens if somebody is already pregnant and then they take a form of emergency contraception like Plan B, for example?
Great question. So if you were to take Plan B and you were already pregnant, it wouldn't alter an existing pregnancy or cause a termination of an existing pregnancy. Instead, the way emergency contraception works is it delays ovulation to help prevent you from getting pregnant in that window after unprotected intercourse.
So it doesn't really affect the baby that's already there. It just prevents the ovulation from happening in the first place, which would have then resulted in a pregnancy.
Potentially, yes.
And I think that's a very important thing to know, because that way people who want to take Plan B can rest assured that even if they are pregnant, the baby would be okay. So it won't harm an existing pregnancy, like Dr. Kendall said. So I hope that answered a lot of your questions and really helped demystify a lot of the things that you might be wondering about birth control. So thank you very much, Dr. Kendall, for being here today and providing us with such valuable information.
You're welcome. I had a great time.
If anyone has any additional questions or comments or just wants to say hi, leave a comment down below. Thanks for watching. Peace.